Yeah, so in CTCL, we're presenting some work on clonal evolution in cutaneous T-cell lymphoma. That's work that we did at Washington University through a pilot project that was funded by the McDonald Genome Institute. And what we did was we looked at some patients very intensively, looking at whole genome sequencing, whole exome sequencing, single cell analysis, and RNA sequencing. And what we were able to do was to recapitulate what we thought would happen in patients with CTCL. So uniquely in CTCL, we have patients who have very indolent disease and then patients who have more aggressive disease. And clinically, it's very common to see that some patients will have one phenotype of their disease, whether that be rash all over the body or thick plaques over the body or high burden of disease in the skin or a high burden of tumor like masses on the skin. And you treat with one drug and one population of that gets better. The tumors get better, but the blood disease gets worse. Or the blood disease gets better and the patches on the skin get worse. And that's always given us clinicians a feeling like we're playing whack-a-mole, treating one group and then another subclonal population pops up. And that's what we were able to show in our patient samples, was that if you look at patient samples serially over time, at times of progression or lack of response to therapy, that you see that different clones evolve and increase and decrease in their proportion. And it's not sequential. So sometimes you'll see mutations in one group that are subsequently lost on a repeat sample, but then regained on a subsequent sample. And we don't think that the patient is losing and gaining those mutations. We think that those cell populations are increasing and decreasing with response to different therapies, which really does mimic how we think about the disease. So unlike how we think about treating other sorts of cancers, where if you have a mutation, you have it from the beginning and you only acquire mutations over time. In CTCL, it's clear that, or it's becoming more clear that that's probably not the model. And there's a lot of clonal heterogeneity going on, and that might impact our ability to use targeted therapy in the future.